All right, first I'm going to discuss before we start in the upper right quadrant, just generalized how your body's positioning would be when you're doing a prophy. When you're a right-handed operator, just as you learned in lecture, you need to be at 8 o'clock to about 12 o'clock when you're on your right side. Left side then is about 4 o'clock to 12 o'clock. So my lefties that are in the class, this is the side you would be on over here working, and if you're right-handed, then you're going to be on the same side that I am. Your legs need to be parallel to the patient, and then you're going to move the patient around for you so it's easier for you to see. When you're doing prophies, you always start in the upper right and you go by quad. So every step you do in the upper right, you then go to the anterior and then you go to the upper left and then you move your way down. So this video is going to show you all of those movements as we're working. I've got my handpiece already set up and ready to go, and then I have my Prophy paste ready to go as well. All the Typodont has been disclosed properly so that I have some pink dye. I know it's a little bit hard to see in the video, but your Typodont should also be ready for doing this checkoff. I also have my saliva ejector, which would be for picking up any of the saliva that a normal person would be. When you're doing this checkoff, you need to also have this part of your setup. This is what we call a candy cane. Obviously, saliva ejectors are normally straight. You bend it like a candy cane so that it can tuck over into your patient's cheek. You can actually ask the patient to hold on to this if they would like to turn it off and on, or it will actually hook over into the patient very easily when you're doing prophies. But you need to have this on your tray. It's part of your checkoff, having this ready, but I'm not going to be able to keep this in while I'm doing the checkoff itself while you guys are watching. All right. So I am starting in the upper right side. So when you're doing the maxillary right buccal, we're going to turn the patient away so that when you're looking into your patient's mouth, you can see the buccal. You should not have to worry about retracting in order to see, because you should be able to look right down into his mouth and be able to see it. I am going to retract so that you guys can see better. You really need to also pay attention to the fulcrums that I'm going to be using. Remember, fulcrums are to stabilize where you're working for patient care so you don't accidentally slip off. I like to scoop up some paste and go on the buccal of the teeth I'm going to be working on. Remember, it's per quad. I'm going to come up to the canine. So I've already delivered some paste to the area, so I don't have to worry about going in and out to get my Prophy paste. You need to make sure that you're following the same motions and the same strokes. You'll start on the distal, and then you'll go the facial, and then the mesial. And I always do this little thing for students so they know if they're going too fast. So you're going to go and push down so that the Prophy cup will flare out. 1, 2, 3, buccal. 1, 2, 3, mesial. 1, 2, 3. Now I'm going to come forward. Distal, 1, 2, 3. Buccal, 1, 2, 3. Mesial, 1, 2, 3. You know that you're not going too fast and applying too much pressure because the handpiece continues to flow around the teeth. It's not stuttering, it's not chirping or making any sounds like that. Now I'm going to come to the canine, facial, mesial. Now I'm going to switch over to the lingual because I'm finished one quad. The lingual is very simple. It's actually one of the easiest spots to work on besides doing the anterior. You need to move the patient towards you. When you move the patient towards you, you look directly down into the patient's mouth, and I can see right into their mouth. I don't have to use anything. I am going to keep a finger here, my pinky on the chin to keep the person open, and I've got my fulcrums and for control. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. I'm going to stop saying that because it gets old on a recording, but you know the general idea of what I'm getting at. Now, some people have really small teeth, and you don't necessarily have to do the 1, 2, 3, as long as you're covering all surfaces of the teeth. Once you're done with the lingual, we go straight to the occlusal. And it's just cusp, 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 cusp. And then our buys are super easy. All right, and then I'm gonna turn because I'm going to the anterior. Remember, we do not floss. And I'm gonna turn to 12 o'clock. Chelsea's gonna adjust with me. I made the patient move for me. I'm gonna lower him a little bit. And now when we're doing 12 o'clock, we can see right down into the patient's mouth. It's one of the easiest places to work. What you need to remember when you're doing the anterior is that their lips can get in the way, and this is where you're gonna really practice your indirect vision. All right, so I'm gonna start at my canine. I'm just gonna come back here. I'm gonna paint my paste on the teeth. Now, when you're working on patients, they have super slippery areas, unlike your typodonts, which are not slippery at all. All right, you guys will really be able to see my strokes when I'm doing this. I gotta get my fingers just right. I'm using their lower mandibular jaw as a fulcrum. I'm holding pin grasp on the handpiece. I'm gonna go the distal. I'm gonna really flare out the Prophy cup so that you can see it. And yes, it is this messy when you're working. Prophy paste does go flying, more so even when you have saliva added to this. You can really see on number 8 the flare out. I'm gonna push really hard right now so you can see. That is not what you would do on a person, but you were able to see the Prophy cup flare. Mesial, facial, distal. Mesial, facial, distal. Something I also want you to be aware of is look at my ring finger and my middle finger and how it is focusing on holding onto the Prophy cup. But my hand in general is using the maxillary arch as a fulcrum. Very, very important part of working in a patient's mouth is your fulcrums. And on the anterior area, it's one of our easiest spots to be able to show you. Now, I'm just showing you repetitive strokes so that you get an idea. Once you do all of the facial normally, then you're done and we're gonna go to the lingual area. When you guys are doing indirect, you need to make sure that you have your mirror in your hand so that you can see. No one should be down near kissing their typodont whatsoever. And we'll literally say, is your patient enjoying your kiss? Because you're too close to their face. Got it good? This one's a hard, is that a good angle?
Yep.
There we go. And now I can't see. So
I just zoomed in so far. Yeah, we're good
it's
now.
okay. I'm gonna show you, it looks like 8 and 9 are probably gonna be the best as far as getting this on video, but it's the same process of going distal, lingual, mesial, distal, lingual, mesial. You would go all the way from canine to canine to be able to do that just like normal. Anterior teeth are the easiest teeth ever to do the little cusp tips. Canines, just little taps. Making sure that you're getting those inside the ledges. Okay? Now, if we're working in the upper left, not if, we are, you turn the patient again. You're gonna have the patient turn towards you. This is a super easy area to work also, and this one requires no mirror whatsoever. I'm gonna get my Prophy paste. I bring my Prophy angle and my handpiece, my mandibular fulcrum. I'm gonna slide up with my finger, and I can see right down into the patient's mouth. When the patient's cheek is slippery, the Prophy angle will scoot right along with it with no problem. So that's the buckle. Do the opposite direction for the lingual. All right, patient straight up. And cusp tips. Now I've completely finished the maxillary arch. I'm gonna come back at 12 o'clock. And now I'm going to floss. Wrapping floss around your middle fingers. You'll learn about this in dental health. It doesn't matter if you pick the right or the left, just remember to stay in sequence. You don't need to actually see when you're flossing. You can feel the context as you're working around. And your floss will break on your Typodonts just like that one just did. All right, I was checking my contacts. All right, I am wrapped around. I'm gonna go to my anterior teeth, wrap. The reason for flossing after the fact is you're dragging the Prophy paste into the interproximal space to help finish polishing that area. After you are done, you will go through just verifying that you have got everything. As staff, we will be checking everything to make sure that there's no disclosing solution. We are well aware that it can be a challenge to get all of it out. Once you're done with the maxillary, you then move down to the mandibular and you repeat the same pattern. Turn towards you, 12 o'clock, turn away from you, etc. There is no difference in any part of that at all.